Hey everyone, and welcome. If you're gearing up for your boards or about to start your OBGYN rotation, you're in the right place. We are doing a super high-yield deep dive into a really critical medication, hydralazine. So, let's set the scene. You're on call, and a pregnant patient is brought in with a blood pressure that is sky high. We're talking dangerously high. This is a full-blown hypertensive emergency, a situation where the clock is ticking for both the mother and her baby. You've got to act fast. And one of the most important tools in your kit for this exact scenario is hydralazine. Let's find out why. Today, we're going to take hydralazine all the way from the pharmacy bench to the patient's bedside. We'll kick things off with the basics, then get into how it actually works, cover the all-important safety stuff, see how it's used in practice, and then wrap up with the one thing you absolutely have to remember. Okay, let's get right into it. Section 1, what exactly is this drug and when on earth do we actually use it? So at its heart, hydralazine is an antihypertensive, which is just a fancy way of saying it lowers blood pressure. Now, its class is a direct-acting vasodilator. That's the key phrase right there. It tells us that the drug doesn't mess around with complex hormone signals or the nervous system. Nope, it goes straight to the source, the blood vessels themselves, and tells them to relax and open up. That direct action is precisely why it's so valuable in an emergency. It's fast and it's reliable. So when does it get called off the bench? Well, it's saved for the really high-stakes situations. It's a go-to for hypertensive emergencies in general, but its most famous role is definitely in managing severe preeclampsia and eclampsia. That's when a pregnant patient's blood pressure just skyrockets, putting both her and the baby at serious risk for seizures and a host of other awful complications. All right, now for the fun part, the how. How in the world does hydralazine pull off this powerful effect? Let's break down its mechanism and what happens once it's in the body. I want you to think of your arteries like tightly coiled springs. When you have high blood pressure, there's a ton of tension in those springs. So you give hydralazine through an IV, and it travels directly to the smooth muscle in the walls of those arteries and basically tells them, hey, chill out. The arteries dilate, which reduces what we call peripheral vascular resistance, or afterload. Afterload is just the pressure the heart has to fight against to pump blood out. So by relaxing the arteries, hydralazine makes the heart's job way easier. And the result? With less resistance, the blood pressure comes down. Simple as that. And it does this fast. In an emergency, you don't have hours to wait. We're talking a typical IV response time of just 10 to 15 minutes. That speed makes it an incredibly valuable tool when you absolutely need to bring that blood pressure down, like right now. Okay, let's talk safety. No drug is a magic bullet. And with a medication this powerful, you have to know what to look out for. This section is all about the essential warnings and those pesky adverse effects. The side effects here are actually a direct result of its powerful mechanism. It all makes sense if you think about it. By opening up those blood vessels, it can drop the blood pressure too much, leading to hypotension. And what does the body do to compensate? It tries to speed up the heart to keep things moving, causing something called reflex tachycardia. Patients might also complain about a headache or feeling anxious. And because of these heart effects, you've got to be really careful using it in patients who already have coronary artery disease or renal failure. So, we know what it is, we know how it works, and we know what to watch for. Now, let's put it all together. How do you actually use this stuff at the bedside? Let's get practical. Now, this is a super important point, and it might not be what you'd first think. The goal is not to get the blood pressure back to a normal level, like 120/80. Nope. The goal is simply to get it out of the immediate danger zone. You just want to reduce that diastolic pressure, the bottom number, to somewhere in the 90 to 100 range. That is a critical point to remember. And this idea directly shapes what you tell your patient. You have to explain, in really simple terms, what you're doing and why. You'd say something like, we're giving you this medicine to safely lower your dangerously high blood pressure. Then you warn them about the possible side effects, like a racing heart or a headache, and tell them to let the nurse know right away. But most importantly, you explain that the goal isn't a normal number, but a safer number, and that's to make sure the baby continues to get all the blood flow it needs through the placenta. Phew, we've covered a lot of ground. So, if you only remember one thing from this whole explainer, please make it this next slide. This is the clinical pearl, the money shot. So, here it is. The whole game comes down to one word: balance. It's all about balancing the mother's safety with the fetus's safety. While you absolutely have to treat the mom's dangerously high blood pressure, being too aggressive can be just as bad. If you drop the pressure too far or too fast, you can actually reduce the blood flow to the uterus and the placenta, and that can put the fetus in distress. So with hydralazine, the mantra is control, don't crash.
Finding that delicate balance, that's what makes for good clinical practice, and it's a concept that is absolutely essential to master.